everybody. Thanks for joining us for our latest edition of Phoenix Children's Live. I'm Stacy Dillier, one of the brand managers here at Phoenix Children's, and today I am joined by our division of ENT at Phoenix Children's. Thank you guys for joining us. We have Dr. Page, Dr. Crockett, and Dr. Nagy. Thanks so much for being here. And today our topic is on ear, nose, and throat. So if you have any questions along the way, be sure to type them in the comments and we'll get them asked of you guys. And then we'll just go ahead and jump right in. So first I just wanted to, our division of ENT is fairly new to Phoenix Children's, about a few months in now, right? Mid-August, I think, is when we started. Yep. So if you guys just wanted to tell us a little bit briefly about each of you and what brought you to Phoenix and to Phoenix Children's, that would be great. So I don't know if you want to start with you, Dr. Page?
Sure. I've been in practice in Phoenix for the last 7 years and was in private practice, did some work at Phoenix Children's Hospital. But over the last year, we've been developing a plan to have a more cohesive system for taking care of kids at PCH, and really kids everywhere in the valley that need a higher level of care and that need the ability for us to communicate with other departments in the hospital and be able to take care of everybody in a better way. So we've been working on that for a long time, and in August that finally came together, and here we are, well on our way.
Yeah, Dr. Crockett. I'm originally from Arizona. I grew up in a small city called Casa Grande, just south of here. So I'm well familiar with Arizona. I did training in Utah, Texas, and then Tennessee at Vanderbilt was my pediatric training. I have a lot of family in Arizona. So part of that's what brought me back, and now I've been here about 3.5 years and excited to be here and be a part of this transition to Phoenix Children's of bringing more tertiary care, ENT, to the Valley.
My name is Sharon Nagy, and I am originally from Texas, and I came here for my residency training at Mayo Clinic, and so I did my pediatric ENT training here at Phoenix Children's. I went away and did my fellowship for a year at the Medical University of South Carolina in Charleston, and I just got back this summer, and I'm super excited to be back here and with you guys today.
Very neat. Thank
We've been
you.
working to get Dr. Nagy back ever since she left.
All right, well, it finally happened.
First time now.
All right, well, thank you all for being here. All right, so all three of you are specially trained in ear, nose, and throat. Can children be born with conditions that will require surgery for ear, nose, and throat, or is it something that develops over time? Does it just depend?
Those are really broad questions, so we'll bring some of that together. I will say that, yes, all three of us are trained in ear, nose, and throat, and all three of us are trained, fellowship trained in pediatric ear, nose, and throat. So that's probably an important distinction to make, is that after we do our 5-year training residency in ENT, there are a variety of different subspecialties that doctors can get into if they're interested. And so all of us and the future docs that we're working on hiring here will all have done an additional fellowship to specifically focused on ENT care for children. There are lots of congenital things that happen in the head and neck area. This is a really complex area of anatomy, and so a lot of things can go wrong in development, and so we deal with many of those things. And so everyone is probably familiar with cleft lips and palates. Those are really common things. Branchial cleft cysts or other developmental problems like that. Malformations of the ears and hearing. Those are some of the common pediatric things that we take care of, congenital things in pediatrics that we take care of.
Okay, great.
Another one of the common things that we deal with is, you're talking congenital, especially at birth, is babies with airway or breathing difficulties. So that's one of the things in our training where we've gotten special experience in dealing with airway complications. Just wanted to point that out as well.
Okay. And so are there any specifically that can develop over time, or is it mostly the ones that children are born with?
We see all different variety of things, and that's what is so cool about pediatric ENT, is that we deal with a lot of congenital problems that can happen right away at birth or in the first year of life, with lots of the things that they were talking about. But there's also things that can develop over time, lots of infectious things. We see and take care of a lot of acute kids in the hospital that have neck abscesses, abscesses around their tonsils, abscesses at the back of their throat. Recurrent tonsillitis is another thing that we often take care of that develops over time. Recurrent ear infections. So there's lots of things that can develop over a kiddo's lifetime that we can take care of.
Okay, great. And how common are ENT issues in children? Is it fairly common?
Very.
There's some of the most common reasons for kids to see their primary care doctors, especially nose, throat, ear infections. And there's some of the most common surgical procedures that are performed in the country nationwide are ear tube placement and tonsillectomy.
Okay. All right. Yeah, you always hear of kids having to have their tonsils taken out.
Very common. Very common.
Okay, perfect. Are certain populations or ethnicities more prone to ear, nose, or throat conditions than others?
Depends on the problem that we're talking about.
Okay.
So there are definitely some conditions that are more common in certain populations, and other ones that affect equal genders, ethnicities, and ages. So it just kind of depends on what we're exactly talking about.
Okay.
In Arizona, one important area is in the Native American population. Ear problems tend to be significantly more frequent. And so not just routine ear infections, but more complicated problems with the ears can develop. And that happens more often in the Native American groups.
Okay. All right. And is there anything families should keep an eye out for if they suspect their child may have, if they're having recurring ear aches or ear infections, that they may need ear tubes? Should they go to their pediatrician? What is the best course of action for something like that?
Typically, with recurring ear infections, you would start with the pediatrician.
Okay.
And if they become to a point where antibiotics are unsuccessful, or they're starting to have difficulties with the antibiotics, or the number of ear infections has kind of met a certain criteria that they're becoming concerning, then the pediatricians will often send them in our direction.
Okay.
That's definitely your first line. They want to.
Okay.
The pediatricians are going to be able to help them be able to follow the kid's development to make sure there aren't other concerns. They'll be able to keep track of how frequently these are happening. A lot of parents will come in and say, "Well, how many ear infections have they had?" And they go, "Oh, I don't know. I can't remember all my kids and all their different things." And so you really need to have a good primary care doctor who helps you know when it's time for you to move forward and see a specialist.
Okay, great. And is there a certain type of treatment method other than surgery? Say, kids are getting sore throats all the time. Is it necessary that they're going to have to always have their tonsils taken out? Are there other treatment methods for certain ear, nose, and throat conditions? Or is it always surgery?
We always try to treat kids medically when it's possible. We definitely like operating. We're surgeons, but we don't like to operate on kids that don't need surgery. So we always like to try medical options first. And then when those are unsuccessful, then we usually go to a more surgical operation to get it taken care of.
Okay, great.
And when families come in to visit with us, we like to go over all the options. So here's the medical option, here's the surgical option. Are there other alternatives? We like to discuss all of that at the time of the visit.
Okay, that's great, and I'm sure the families really appreciate that.
I would say allergies may be the most important thing that we treat medically a lot.
Okay.
Because allergies in the head and neck area can lead to recurrent sinus infections, recurrent ear infections, chronic sore throats. And so that's a really important area that won't really get better with surgery. That's something that requires medical treatment. Sometimes that requires other specialists like an allergist to see, but we do a lot of medical treatment for that. And that can sometimes prevent the need to go forward with surgery.
Okay, that's really great. Is there a certain age that a child can have surgery? So if it's deemed that they do need surgery, would you hold off until they reach a certain age? Is it just dependent on the child?
It's dependent on the child. It's dependent on the problem. So like we kind of talked about, we deal with such a wide range of problems that some babies need surgery at birth or shortly thereafter to take care of a really significant problem that they were born with. But we operate on the full spectrum of kids all the way until they're age 18.
Okay, that's great. And if they do need surgery, what can families expect before, during, and after the surgery? Is it, what does the recovery time look like? Sort of just give us an overview of what that process looks like for families.
There are so many different surgeries. That is an impossible question.
Let's pick your most common surgery, and we'll go with that one.
So ear tubes, very simple, very straightforward.
Yep.
The kids do great. They recover the same day.
Okay.
I tell all the parents, by dinner time, your kid's going to be fine. So they wake up cranky, they have a sleepy day, but then they're much, much better after that. On the other end of that, tonsillectomy, one of the other really common things we do, is much harder for a lot of kids to recover from. Bad sore throat for several days. They often need to be pushed to drink enough so they stay hydrated. Some of them need pain medicine. Then again, kids are very different and very resilient. Some kids bounce back even from those more difficult surgeries, recover quickly, go right back to school. It's amazing to see what they can do.
That's one of the hardest things. Like, families always ask us, how long until they can go back to school? How long are they better? It's very unpredictable in children. Some, like Dr. Page was saying, some children bounce right back, and some take a week or two, and it's really hard to predict.
Sometimes the parents are better predictors than we are.
That's true.
Okay.
They know the kids. They know how they respond to illnesses and problems like that, and they'll be able to say, I think this one's going to be hard, or I think they're going to do just fine, and they're usually right.
Yeah.
Always trust mom. Yeah, she knows.
Okay, great. And I've heard that it's easier for children to have like their tonsils taken out than adults. So if a child needs it and they maybe are wanting to wait, is it easier for a child to recover than it would be for an adult for something like that, or is that just a myth?
Adults have a much harder time.
Okay.
But there's a wide range of kids that are appropriate to get their tonsils out. One big difference is kids that are under age 3 always have to spend the night in the hospital if they get their tonsils removed. Older kids usually are able to go home, but it depends on their medical problems or their other health issues that are related to that, or how significant their problems are related to their tonsils. But the older you get, the less likely you are to have to spend the night in the hospital. So teenagers usually don't, but they're also much harder in terms of recovery and how they cope with it.
Okay.
I think, too, usually the indications are a little bit different. Usually for our younger children, we're taking out tonsils and adenoids for problems with sleep. So they're snoring, they're mouth breathing, they have pauses in their sleep at night, they're tired during the day, or they're not acting themselves. Whereas a lot of times in the older population, we're taking them out because they're getting recurrent strep throat. So I think that there's something that kind of goes along there, and there's a lot of repetitive bouts of infection, inflammation. It's just harder on them.
Okay. All right, that's good to know. All right, most fun question of the day. Tell us about the Division of ENT here at Phoenix Children's Hospital.
I'll let Dr. Page.
All right, we'll start with that. Well, so these are the 3 doctors that form the unit to start with. We have an additional doctor who's going to be starting with us in January, Dr. Mancuso. We have 2 nurse practitioners that have just started at Phoenix Children's that are still getting their bearings, that are going to be prepared probably to start seeing patients around January as well. We have our primary office here at the hospital, and we have a busy office already in Mesa that is up and running. We have a new office that will be opening in the West Valley in I think around April, and then likely an office in Scottsdale starting in the fall. So those are, the farther out you get, the more questionable those dates are. But that's about the time frame we're looking for. So we hope to be able to have a presence all over the valley, but at the same time provide care here at the hospital for the really sick kids here in the ICUs, the kids that come through the emergency room. So we want to balance both of those so we can take care of the really healthy outpatient kids that maybe just need ear tubes, but also be sure that we have somebody here ready to take care of the sickest kids that we have from all over the state, in fact, that come to Phoenix Children's Hospital.
Okay, great. I'm very excited to have this division here at PCH. It's a great addition. Do you work with other specialties throughout the hospital? A lot of our programs are multidisciplinary. They, coordinate with some of the other divisions. Is that the same for the Division of ENT?
Very much so. We have a lot of good relationships with our colleagues in the pulmonary medicine, gastroenterology, cardiology, cardiothoracic surgery, plastics and craniofacial surgery. What else am I missing? GI, neurology, sleep medicine.
Pretty much every area.
The head and neck kind of crosses over in a lot of different fields, and we collaborate and discuss many children and try to work together with a lot of those other subspecialties.
We're currently a part of the aerodigestive clinic, working with children with feeding and difficulty swallowing. We're a part of the 22Q clinic, a part of the craniofacial clinic, vascular malformations clinic, with specific emphasis on those that occur in the head and neck.
Starting the obstructive sleep conference.
Yeah.
We're starting an obstructive sleep apnea conference.
Kids with severe apnea.
In large part, we and people like us are interested in being parts of those things because we feel like that elevates what we're able to do for kids with complex problems. And so we have a real interest in multidisciplinary care, and we're likely to be able to expand the types of services like that are here. And so there's already work, like the Obstructive Sleep Conference starts in a week or two for the first time, and hopefully will be a real service. We'll have a voice clinic plan that will be starting in 2018 for kids with voice problems. And more down the road. I mean, as we're working on more and more, cochlear implant team that's still getting organized. And so I think that as we, being part of PCH gives us the opportunity to do that, where we can work closely with a lot of other specialists and look at opportunities. I mean, really, Dr. Crockett got the sleep idea started when he came and said, why don't we pull these people together and get pulmonary and neurology, people who really have an interest in this, and see if we can make this better. And they felt the same way. They jumped right on it and wanted to make that work. So we have a lot of other doctors in the other specialties who really want to work well with other areas, and we all learn from each other.
That's great.
And on a daily basis, we work with our colleagues in audiology and speech therapy and feeding therapy. I mean, that's every day we're working with those specialists.
Couldn't do our job without them.
Exactly.
The audiologists we have in our clinic every day, there's an audiologist to do hearing testing, talk about hearing aids,
and they're
fantastic. With some of those problems.
They're amazing here. So that's great to work with them.
I'm sure the families really appreciate that connection with all the different specialties as well. It makes it easier for them.
Yeah, it definitely makes communication easier. It's easy to go into the patient chart and read what's been going on with some of our more complex kids that are seen in various multiple divisions at Phoenix Children's, and be able to have that open dialogue and regularly communicate with other providers that are here about these more complex children and their care plan.
Okay, great. Do each of you have a certain area of ENT that you're most interested in, more focused on? I know you mentioned the different, airways and stuff like that. Do you each have a certain specialty area within ENT?
To some degree, I think we all do most general pediatric ENT. So, your tonsils, your tubes, all of that. We all deal with that on a daily basis. I think for the most part, we all treat all conditions. We do have some special interest. I know Dr. Page really enjoys cochlear implantation. I enjoy speech surgery, cleft surgery, sinus surgery. Dr. Nagy has similar things, so I'll let you guys talk about what you enjoy. I'm a part of the aerodigestive team. I really enjoy that. Part of the 22Q team. Really enjoy that as well.
Yeah, I think we want to be able to be sure that we provide all the services that kids need. But for very specific things, we don't all have the same experience or training in those, or the same interests. And so what we want to do is allow each of us to be able to kind of expand our interests into areas that we love. Yes. People who are passionate about certain things tend to do a better job at those things and really work at it. And so, for me, the Pediatric Voice Clinic that's up and coming is one of my real loves, and I do enjoy cochlear implants, working with those kids who have hearing loss. But I don't want to neglect all my sinus and airway patients. That's a good group too that we like to have.
That's the nice thing about pediatrics, is you get to do it all.
I really enjoy the care of cleft lip and palate patients, speech surgery as well. I'm really looking forward to build a complex airway patient population and doing some more airway reconstruction. And so that's kind of more of what I'm hoping to focus on as well.
Very exciting. All right, so you've mentioned a lot about the pediatric population. Why is it important for kids to be treated by surgeons and physicians who are specially trained in pediatrics, especially when it comes to ear, nose, and throat conditions?
I think that we have some very skilled general ENTs in our community that take very good care of kids. I think that what we can offer here at Phoenix Children is more than just us as well. So we have a wonderful hospital that sometimes kids are sad to leave because there's so many cool activities here. The child life specialists are amazing. We have pet therapy where pets come in and get to hang out with the kids. Our child life specialists are like blowing bubbles for the kids as they go back to the operating room. They're doing a new virtual reality study where our kids that are going back for tonsillectomies have virtual reality goggles on, so the anesthesiologists are like trying to decrease anxiety levels by doing virtual reality. And so there's so many cool things and fun things that are happening here that, I definitely do think that we have expertise in training with children, but we also get the support of being in a children's hospital, which has a lot of other amazing things for kids.
I would agree with that completely. We also have great pediatric anesthesiologists. So if your child does need surgery, we really only work with pediatric anesthesiologists, which is a bonus.
The definitions of pediatric ENT in the long past, people talked about two things: specific complex surgery for kids and simple surgeries for complex kids. And so I think we offer those things a better experience for the kids who have those needs that we need to take care of. And so even a kid who just needs their tonsils out, a very common routine thing, can, especially if they're a child with medical problems or behavioral concerns or developmental delays or things like that, are going to have a better experience in a place where everyone's dedicated to taking care of kids.
Okay, that's great. I'm really glad that you guys are here. This is great.
So are we.
Yeah, happy to be here.
How can patients make appointments? Do they have to do they have to be referred in from their primary care provider? Can they just call you up and say, hey, we think we need to come in and see you? How does that process work?
You bet. They can call us.
Okay.
602-933-EARS.
All right, there we go.
602-933-EARS.
Easy as possible. 933-EARS.
But the referral question is really an insurance question. So
Yeah.
many insurance plans require you to get a referral. And again, a lot of times, if you think you might need to come in and see us, seeing your primary doctor is the right answer. You come in and say, hey, I have concern about this. What about seeing an ENT? And they can help you. They may be able to say, no, we're going to go a different direction. There are other things that you can do instead, or direct you right to us.
Okay, great. All right, is there anything else that we didn't touch on that you want to talk about? Or I'm excited about the upcoming year that you guys have ahead of you.
A lot of great stuff.
You do, I know.
Sure. So we should do this again.
Okay.
We have more updates to tell people about.
Okay. We will definitely
We are
do that
growing
again.
at an alarming rate, and we're excited to be here. So yeah, I think it'd be great to do it again and
Okay.
give updates. And
We will definitely do that.
I know patients right now have had a hard time getting in this initial phase, and some of that was just the transition in our practice, Dr. Crockett's practice and mine as we got started, adding Dr. Nagy a little bit later. We are well aware of that, and we're working on all of that to try to make that a better experience, get more people in, and I think as we go through the next few months, that'll be easier and easier to get taken care of.
Okay, great. Well, thank you all for being with us today. We really appreciate it. We will do this again soon.
Great.
Thanks, everybody. If you have any other questions, be sure to leave them in the comments, and we'll get them over to our doctors and we'll get the answers for you. And tune in on Wednesday, November 1st at noon for our next edition of Phoenix Children's Live on Pediatric Epilepsy.
Thanks, guys.